Hello, happy Monday, everybody. Welcome back to another episode of our Learn with Flow webinar series. We're going to keep diving into these symptoms as we really take this month of June. I had to think about which month it was. That was really sad. Really take this month of June to dive into what I want to call our symptom series. I get lots of different questions, not only in-person patient intake forms, but even great DMs from individuals that really ask about certain symptoms and how do they relate to their overall metabolic health? How do they really explain or give us some clues and indicators of what might be happening from a hormonal level or a gut level? And so we've been using this month of June to really tackle some of the most common symptoms that I see on patient intake forms in my private practice. So we got to build on conversations around anxiety week one, and also even talking about how anxiety isn't just a brain response, but more of that body to brain response, which is huge to really be able to delineate those types of conversations. So that was what we got to dive into last week. We're going to really continue a lot of those conversations as we approach something a little bit different than just a generalized anxiety-based symptom, but I would say another very common symptom that I see on patient intake forms is going to be brain fog, right? And brain fog is kind of a arbitrary or kind of a ubiquitous term. It's a little bit vague, I guess is what I'm trying to say here. And brain fog can be defined a bunch of different ways, but we want to really look at it and take it seriously, because I think that a lot of times individuals that are struggling with brain fog, focus, memory, concentration issues, it kind of gets left off a little bit as either a normal part of aging, normal part of parenting, normal part of womanhood, right? Or we'll talk about this today too, but how many moms I've heard who just refer to it as mom brain, and it definitely is common, but I don't want that to ever feel normalized in that sense, right? So as we really dive into the symptom series, I want to hear from you guys if there's any other symptoms that you want to be diving into, and we're just, like I said, I'm going based off of best votes from the general majority and the most commonly asked questions and symptoms that I see in practice as well too, and how I tend to take a different approach to a lot of these conversations than even just a conventional medicine type feel, right? So when we think about some of these noticeable changes in things like whether it's energy levels, mood, sleep, digestion, I really think that it's an opportunity to start to look at bigger issues going on, right? We have to understand that if we don't start to jump in to some of these symptoms early on and really take them seriously, then they're really just the first little red flags or warning flags that our body is trying to put out that there's some bigger issues going on, or really bigger issues that are building underneath the surface. And if we don't listen to them now, then they're probably going to end up being bigger issues in the future, bigger, scarier things, whether it's autoimmune disease or metabolic syndrome, type 2 diabetes, depression, any of those types of things can really manifest from just these smaller red flag warnings that we either do or do not really take seriously. So what we're going to dive into today is that symptom of brain fog, whether you call it brain fog, difficulty concentrating, forgetfulness. I would say this is a very, very up there within the top 5 of the most common symptoms I see on patient intake forms. So let's really dive into what is brain fog? How do we really look at brain fog from a conventional medicine aspect? How do I really look at and treat more of a brain fog scenario, and give you guys some general understanding of different testing that you should be doing to identify the original root cause source, and how you can start to reverse any brain fog if you feel like this is me, she is speaking my language here. How do I open up this mental cognition again? I got you. So listen up. So let's really set some definitions first and define what is brain fog. Again, it's very normalized in our culture. Some people even call it mom brain. I literally heard one gentleman yesterday, he called himself Old Man River, which is just that he was laughing and he was able to be comical with himself, but he's like, yeah, gears just don't shift the way that they used to. Meanwhile, he's in his mid 40s, right? So are we normalizing something that is common and then we're just kicking the can down the road and not really listening to our body really expressing some first signs of what we call neuroinflammation, right? Our brain is an organ, and we want to really understand that it can be inflamed just like any other part of our body. And when that happens, synapses don't connect, right? Those thoughts don't connect quite as readily. Our memory isn't as good. So I would say brain fog can be characterized as a constellation of several different symptoms. Some people identify brain fog more as like difficulty concentrating or multitasking. We can also categorize it under just the forgetfulness. One of the most common analogies that I use is, do you often find yourself like walking into a room and you pause and you're like, why did I come in here? What did I come in here for? That's kind of that brain fog type feeling. Feeling spacey or feeling confused. Word finding difficulties, like something that what it should be called. You're like, what is the name for that? What is the name? It's like, yes, a ladder, right? And it's like you're finding trouble getting that word search on a more fast basis, or it could even be defined as mental exhaustion or fatigue. Some people just have that, my brain feels overloaded type of thing. I have no more bandwidth. There's no more capacity here, right? So when we think about brain fog, I just want to make sure that we're all on the same terms of brain fog can really feel and look like a bunch of different symptoms for individuals. And it's a matter of identifying that so that we can take it seriously and not just push it off as mom brain or old man river or a natural consequence of aging or anything like that. One of the most, I think, stories that sticks out to me working with an individual that came in with brain fog, also some joint pain and some muscle issues, some neuropathy type symptoms that were starting. She expressed, and again, she was very lighthearted with herself, but she was like, I am finding myself having to consciously and like purposely think about how I get home. She's like, these places that I go all the time, like dropping my kids off to school or the grocery store or whatever. She's like, I get in my car and like I have to consciously think. She's like, okay, you're going to take a left at this light and then you have to take a right at that stop sign. And she's like, I always used to just drive on autopilot, right? It's like I would know my way around. She's like, I have to stop and think, or there's been times where I don't stop and think and I just blow right past my turn. I'm like, those are typical kind of brain fog type scenarios. Or she was also feeling this same exact thing at work. She felt like the same tasks that she used to be able to do very quickly, now were taking her a lot longer, right? And so instead of just brushing this off or kind of laughing about it together, we were able to really talk about it. It's like, hey, how do your labs really confirm that type of symptom? Where do we want to kind of dig in and maybe understand where that might be coming from? And how do we want to try to reverse and support that for you? So we'll come back to this patient in a little bit and talk to you about the journey that we went through, how we identified her root cause, what we did to support that together. But know that brain fog doesn't just have to be difficulty concentrating. It could feel like forgetfulness. I don't know why I walked into this room. Tasks are taking me longer than normal. Can't find the words for things. Can't remember names, right? Quite as well as I used to. Those are the types of things that kind of categorize under this brain fog. Now, when we talk about why we have a lot of individuals that aren't really finding answers to brain fog, usually it's because from a conventional medicine standpoint, brain fog is not recognized as like a formal medical diagnosis. There is no formal criteria that can diagnose somebody with brain fog. So unfortunately, it's one of those where we may chirp up about this in the context of maybe other symptoms that we're dealing with. And it usually, from just a strict conventional medicine standpoint, it usually has to get pretty bad before there's going to be some sort of intervention around it, because we are trained as more of like the conventional field is more trained in terms of like looking at labs. Is there a lab marker out of range? How do I treat it? Right? Very like step by step, very cookie cutter. There's no lab marker for brain fog. I'm not going to draw something in your blood, be like, oh, yep, brain fog is elevated, so we're going to then slide in a pill to fix it, right? So that's usually why we struggle here. And also it's one of those very early warning signs of bigger neuroinflammation, or honestly just total body inflammation. And if we don't catch it early, then it is going to be something to where it may turn into bigger issues down the road, that then by the time those bigger issues manifest themselves, whether it's other neurological conditions or more noticeable memory loss or memory changes, then you're going to get the referral out to a neurologist. Then you might be now in a mode of like looking at these big scary diagnoses. It's like, let's not let our health get there. Let's really start to be more proactive about how we treat our body, which then is how we treat our brain as well too. So inflammation in our body, inflammation in our gut, inflammation in our joints, like we notice that because it's pain. Right? We notice it as, oh, it's redness, it's swollen, it's painful, or like my gut feels bloated, it feels burning, right? It's like we feel that, but we don't necessarily get those same sensations with our brain all the time. Sure, maybe things like a migraine or a headache, which are other signs of neuroinflammation, but sometimes even just manifesting as the brain fog can be some of those first warning signs that we definitely want to chirp up about. So you're not going to just see it on a conventional lab. You're going to need to work with a practitioner that takes those types of things seriously, but also understands, how do I look at ratios in relationships? What are some of the root causes of this brain fog picture, and how might that be fitting into the overall treatment strategy here that we want to really tap into? So when I think about the brain fog and how we want to really loop in, maybe from a more holistic perspective or more of a functional approach, we want to start to zoom out and say, okay, where is this brain fog maybe originating from? How do we trace it back to the root of the root of the root? What are some common causes of brain fog? And everybody having their own journey here, right? So it's not a one size fits all. It's not a just, oh, here we can take some, I mean, there's all sorts of different neuro and cognitive supplements out on the market, but I'm telling you right now, you could take all of those fancy supplements in the world, but if you're not addressing the root cause, then your brain fog probably won't feel much better, right? Even whether it's your functional mushrooms out there, like I love utilizing these types of supplements, but I think that they have a space and a place, and I don't think that they should be used solely without understanding what's my root cause and how am I changing my nutrition, my movement, my lifestyle, my nervous system support. How am I really changing the way that I live to reverse the brain fog, not just put a supplement on it, which is no better than putting a prescription on top and just going about our merry way, thinking that we don't really have to change anything about our health because you're just kicking the can down the road. The neuroinflammation is still there, it's still present, and it's still progressing unless you really go back to the root. So you could take any fancy dancy supplement that you want for brain health and cognition, but if that neuroinflammation is still there, it's still building, right? So that's always kind of that first red flag warning I want you guys to be able to better listen to. So from a functional perspective, after I get people kind of thinking bigger picture, they're like, oh, so you're saying that my brain fog, my forgetfulness, my spaciness, my difficulty concentrating, multitasking is really just one symptom and kind of a bigger mixture of metabolic dysfunction? Yes. Very honestly, yes, that's where we're going to really be digging. So what are some of those more root causes of brain fog that I like to dig in and kind of associate to find everybody's root cause? Number one, you've heard me talk about it once. I'm going to talk about it a million times over. Blood sugar imbalances is going to be a major one, not only because blood sugar highs and blood sugar lows can both feel like brain fog. They can both feel like my mental cognition isn't really firing on all cylinders, because high blood sugars are going to elicit more of an insulin response. And insulin can be a very kind of like pro-inflammatory response, especially to the brain and the body. And then if we have a low blood sugar, we get that cortisol hormone, and cortisol is our body's anti-inflammatory hormone. So it's like, hey, if there's inflammation, it's going to spill into the bloodstream to try to fix it, but not without damaging consequences, right? So we have to recognize that as long as we're riding this blood sugar roller coaster, it's probably the biggest source of inflammation in your entire body, but definitely your brain. If you guys are more interested in kind of some of the like metabolic processes or the metabolic disease of the brain, there's lots of different practitioners out there that are discussing it. I would say Dr. Perlmutter is one, also Dr. Chris Palmer. So there's lots of other neuroscientists and neuroendocrinologists out there that are talking about just this. They're talking about how they use nutrition, movement, lifestyle, supplementation, like strategies in their patients with these types of neurological disorders, right? So it's not a foreign concept. It's just newer in the space that it's kind of acceptable, that it's like, oh, we need to be looking bigger. We need to be looking deeper if we're going to really target the brain, right? So brain fog is really just one early step versus until you get to some of these kind of bigger, scarier things that maybe some of those other practitioners might deal with as well too. So blood sugar highs, blood sugar lows can definitely impact cognition. So to really run some labs on that picture, you would want to definitely know what is your fasting glucose. Ideally, it's 70 to 90. You would definitely want to know what your fasting insulin levels are, ideally below 7. We want to see what your hemoglobin A1C is doing, both highs and lows. I've seen too low on my hemoglobin A1C, which can indicate someone is averaging like blood sugar lows or blood sugar crashes, or too high on hemoglobin A1C, which is more of that metabolic syndrome or kind of on the verge of a type 2 diabetes type picture. So really looking at blood sugar and blood sugar labs, step number 1 there. Number 2, really looking at sleep quality, quantity of sleep, quality of sleep. We know that the brain and the body has these capacities to really turn over cellular waste in that time of deep sleep. So it's not just, oh, I get 8 hours a night, but I don't go to bed until midnight and I wake up at 8 a.m. It's like, well, if we think about it though, we know that a majority of deep sleep happens between 9 a.m. or 9 p.m. and 2 a.m. So if we're only getting a small window of that deep sleep, then you're not getting that cellular turnover, those garbage trucks that get to kind of come into the brain and the body and really do a nice big sweep and clean out the system. So it's not just sleep quantity, but it's also sleep quality, it's bedtime routine, it's how are we really making sure that we get that time to turn over some of that cellular waste and that cellular byproducts in the brain as well too. So that's where just coaching people through some cortisol practices, also a good sleep and wake routine, bedtime routines, and kind of bedroom environment in general, looking at relationship to things like caffeine, alcohol, nighttime eating, stuff like that. So I love, from a data perspective, I love using different wearables out there. I think the Oura Ring has a really great sleep tracker on it. I know I personally use that one and wear it at night because you can actually see like deep sleep versus REM sleep versus light sleep. So it kind of gives you not just quantity of sleep, but quality of sleep. And I know there's a bunch of other sleep trackers and things like that out there too, that also utilize that type of technology. So from a data or a metric standpoint, that's usually one of the best ways to measure it, or even just subjective, how are your energy levels feeling throughout the day? Because I have plenty of people that sleep enough, but they don't sleep very well. And so they end up with really feeling that fatigue and sluggishness. Also goes without saying, make sure you rule out anything like a sleep apnea. That can be an additional test and or kind of sleep study that can impact sleep as well too. Number 3, when I'm digging into root causes of brain fog, I'm going to be looking at the gut, specifically this intestinal permeability, or what the functional field is kind of called or coined leaky gut. We know that there's going to be a big influence here if the immune system starts to get a hold of some of these food particles that are getting out of the gut when they shouldn't be. That can really be a big attack and can cause some neuroinflammation. There's also a really big connection to brain fog and various food sensitivities. Now, remember, if you go way back to some of the early days of Learn with Flow episodes, we talked about food sensitivities, and we talked about how food sensitivities in and of themselves aren't a root cause, right? If food sensitivities are the result of a leaky gut, we need to figure out, why is the gut leaky? We need to remove some of the threats and the onslaughts of that, and then we need to come in and really heal and seal that approach. So we want to really make sure that we understand that it's like, oh, I have brain fog, I cut out gluten. It's like, cool, that might be like a good starting spot, but then why did we need to cut that out? What are we doing to really reverse that scenario? But I do think that there's a lot of very supportive research out there around the role of food sensitivities, specifically things like gluten or leaky gut and brain fog. If you guys haven't read or come across the book Grain Brain, you wonder why they talk about that, is because there's lots of different scientific studies that are looking at just that. Nutrient deficiencies can also be a big one. Low fat diet, just in general. When I talk nutrient deficiencies, some individuals, if you've had a history of more like the macro counting, calorie counting, and you get into this like low fat temptation or low fat craze, that can be a really big marker or sign of some neuroinflammation, because our body, specifically our brain, loves fats. So if we're not getting enough fats, and then without enough fats, we're not able to absorb our fat-soluble vitamins, vitamin A, D, E, and K. So I get people all the time and they're like, I supplement with vitamin D. I'm like, well, your levels look like garbage. So obviously we're not absorbing what we are. So it's not as much as just taking a vitamin D supplement. It's like, you got to be able to absorb that and you got to be able to utilize it. So there has to be this food first approach to the equation too. If you're consuming a lot of processed foods with food dyes, with food additives, that's also been linked to some brain fog or neuroinflammation. I think there's going to be more and more that will come out about that as well too. And then last but not least, when it comes to my world of thinking about root causes of a brain fog scenario, is going to be looking at hormonal transition, specifically for my ladies going through something like a perimenopause or a menopausal transition, very much linked to a brain fog type of scenario. Not that there's anything we can necessarily do. We're not going to stop menopause. We're all inadvertently, as a woman, we're all headed that same direction. So the goal is to be able to support your body to really glide into menopause naturally. And a lot of times it's a double pronged approach, right? As we get into menopause, we might have higher cortisol levels or higher stress levels that we're leaving them unchecked. We may have some changes in insulin sensitivity and some blood sugar imbalances. Maybe we've been getting into a perimenopause or a menopausal place, and because of that our body composition has changed, and so we get this urge to diet harder or exercise harder, which is now creating more nutrient deficiencies. So I say perimenopause and menopause because it's obviously part of the equation when we have these declining or fluctuating levels of estrogen and declining levels of testosterone. Absolutely can be contributing to that brain fog picture, but also usually the perimenopause and menopause transition is happening in conjunction with some of the other ones that I've already named, whether it's blood sugar imbalances, cortisol, gut issues, nutrient deficiencies, and then the kind of the perimenopause and menopausal transition is kind of that last piece of the puzzle that really just sets them over the edge. So when we're thinking about really looking and digging into a root cause, you're going to want to get some labs, but you're going to want to have labs that are going to help correspond to your root cause, right? It's not going to be just about a pill. It's not going to be about a supplement. At least in my world, you can find other practitioners that will do that for you. That's absolutely fine. But I'm more like, why? What's the root cause? What are we going to do to reverse this? Because I could slap a pill or slap a supplement on it, but I'm not reversing the neuroinflammation. I'm just allowing you to live with that neuroinflammation continuing to build until it becomes a bigger issue down the road. And then what did I really do for you, right? Or what did we really do for your health? So, like I said, definitely looking at some detailed blood sugar markers. You could even throw in some inflammatory markers, whether that's high sensitivity C-reactive protein, homocysteine markers, looking at things like B12 and vitamin D levels to look at gut health, nutrient absorption. Also really even looking at like full metabolic panel, whether that's estradiol, testosterone levels, FSH, progesterone. I would even look at things like liver enzymes. Liver enzymes are going to really tell us how well is the body detoxifying, knowing that the liver is one of our major metabolic organs. So going back to this patient that I was helping, working with her over the course of about, 3 to 5 months, we really targeted. She had elevated insulin levels. She had some elevated blood sugar and hemoglobin A1C levels. So we really trapped this from more of a food first approach for her. And I would say within the first, for sure, 4 weeks, if not 8 weeks of making a lot of these food first changes, she's like, oh yeah, Lauren. She's like, my joint pain and some of the muscle stuff isn't completely gone. She's like, but the brain fog. She's like, so so much better. I'm like, see, I'm like, it wasn't just her. She was trying to chase all of these different supplements, like, oh, let's do a magnesium, or let's do this brain cognition blend, or let's do these lion's mane, and like all of this stuff, which is all great and valiant efforts. But I'm like, you could throw anything in the kitchen sink at that bad boy, and if you don't deal with your blood sugar picture, it's not going anywhere. And in fact, the inflammation just continues to build, right? So we were able to really identify her root cause approach and really go at it in that manner and reverse it, right? Now, everybody's a little bit different. Not everybody's road will be exactly the same. That's why taking a customized approach is so important. So whether it's brain fog, whether it's anxiety, whether it's other issues, it's like I said, it's downstream, it's gut issues, it's joint pain, it's cravings, it's fatigue, it's bigger issues such as autoimmune conditions, known hypothyroidism. Those are the types of things that are really building from a root cause. And that's what I'm so passionate about, is helping individuals identify what is that root cause. How do we support the body from the foundation up, and not just piecemeal or DIY this approach with Band-Aid solutions that just end up kicking the can down the road and maybe building to something bigger before we're really able to get to that root cause. So if you guys have been following along on social media with me this weekend, I officially announced that we're open for another round of our Revive, Restore, Renew You hormone healing program. This is a 16-week program. We're going to launch on July 1st. So you have just a little bit of time the next couple weeks here to get registered for that. And that's going to be working through getting labs, working with me on a one-on-one basis, having downloadable tools and resources and ebooks and meal planning guides, really guiding you through this exact approach that I'm talking about, right? So whatever you're coming to the table with from a hormonal imbalance issue, we're going to be able to identify what's your really root cause picture and develop that protocol to help you work through it over the course of our 16-week journey. So I'll make sure to drop the link on this video to register for that. If you are interested and you want access to one of my VIP promo codes that gets you 20% off, you have to send me a DM and tell me that you're interested in my VIP seat, and I will get you a discount code over. That is only good through the rest of this week. So if you're interested, get on that right away. But I'll look forward to seeing lots of your faces jump into my Revive, Restore, Renew You program, or at least joining us next week for another episode of Learn with Lo.